Hello everyone, a very good morning to all of you. So yesterday we talked about a few cardiovascular disorders and today we are going to continue with that. So we are going to start off with hypertension. Okay, see these sessions are basically a quick revision of most commonly asked topics in NEET and INI-CET MCQ. So if you want in-depth videos of all this, it is available in our app. So I've given the link in the description, you can download it. So hypertension is basically increased blood pressure. Okay, so hypertension can be of two types. One is primary, which is essential hypertension. 90% of the times it is going to be primary hypertension. And then the primary hypertension, the causes will be multifactorial. Okay, so it is because of genetics and lifestyle. Okay, so the next one will be the secondary hypertension, which is seen in 10% of the cases. It will be because of any underlying systemic diseases, say for example thyroid or any adrenal gland or kidney diseases. Okay, so secondary hypertension seen in 10% of the cases, underlying cause. Primary hypertension 90% because of genetics or lifestyle modifications. Okay, so basically blood pressure, okay, blood pressure is nothing but the peripheral vascular resistance into, or the systemic vascular resistance into the cardiac output. This is what we call it as blood pressure. Okay, now the primary hypertension, if you see, it occurs because of increased systemic vascular resistance because of thickened vessel walls. What do you mean by this? Is basically, imagine a blood vessel which is extremely thick. Okay, extremely thick means it pump enough blood? No. Extremely thick, extremely lazy. Okay, so what happens, because of the thickened vessel wall, the diameter is going to get reduced and the contractility power is going to get reduced. So this is seen in patients who are smoking, diabetes, and with aging. Okay, so these patients will have thickened vessel walls, so the diameter is going to get increased, the blood is not going to get pumped properly. And the systemic vascular resistance also due to increased vasoconstriction. So vasoconstriction is increased vasoconstriction in patient with stress or obesity. Okay, so whenever there is an increased vasoconstriction, there is going to be constriction of the vessel wall. When there is only constriction, there is not going to be enough blood pumped out. Okay, so the resistance of the blood vessel increases. Basically, it is the vessels are finding it very difficult to pump the blood. Okay, now when the patient is taking increased salt intake, so what happens, the patient is going to get increased salt intake, because of which the sodium and the water retention is going to increase, and that is going to result in increased cardiac output. So these are all the primary causes for primary hypertension. So secondary hypertension, if you see, it is because of renal, endocrine, and pregnancy. So when the patient is having any renal disease or renal perfusion, the blood flow in the kidneys is less. So what happens? There is going to be renal vasoconstriction. So body tries to compensate it. So renin, angiotensin, aldosterone mechanism is activated, and sodium and water retention. Again, it is going to result in increased cardiac output. Endocrine causes can be because of thyroid, hyperthyroidism, hypothyroidism. Hyperthyroidism causes increased cardiac output, and hypothyroidism causes increased peripheral vascular resistance. And pregnancy, you can see preeclampsia. So preeclampsia is a combination of hypertension plus proteinuria plus edema. Okay, so when the body is having increased peripheral resistance or systemic vascular resistance, the vessel wall diameter increases, so there's going to be decreased, the dilatation is going to get decreased. Okay, so the resistance is going to be more, and because the patient is having increased cardiac output due to sodium or other causes, there's going to be increase in the blood pressure. So blood pressure is basically peripheral vascular resistance into cardiac output. When peripheral vascular resistance is more and the cardiac output is more, then the BP is obviously going to be more. Okay, now moving on, let us talk about the few normal values in hypertension. So normally it is considered as 120 is systole and 80 is diastole. Okay, so pre-hypertensive state, these are all the values which you should know, you should memorize it. Okay, pre-hypertensive 120 to 129 systolic, and stage 1 is 130 to 139 systole and or 80 to 89 diastole. Stage 2 is more than 140 mmHg systole and or more than 90 mm or Hg systole diastole. So hypertensive crisis is more than 120 systole and more than 120 diastole. So there is something called as hypertensive emergency. What is hypertensive emergency is when the blood pressure is more than 180 bar 120 mmHg with end organ failure. Okay, so with end organ failure, there is going to be hypertensive emergency. These patients need to be taken to the hospital immediately. Okay, so these are all the basic values. See, hypertension is extremely dangerous to the heart because, see, imagine a patient having a blood pressure. Okay, so the left ventricle is having increased resistance. Okay, the vessel wall is going to get increased, so the it is going to become hypertrophic. So left ventricular hypertrophy cannot pump the blood because it has become stiff. It is showing increased resistance to pumping, so the cardiac output is going to get decreased, and that is going to result in left ventricular failure, backflow of the blood. We did in the last session, right? So what will be the treatment for this? If you see, so the primary hypertension, what I can do lifestyle modification with or without drugs. Secondary hypertension, definitely lifestyle modification plus drugs. So this is what hypertension is all about. So this is the basics of hypertension, and if you can apply this, you can solve any MCQs pertaining to hypertension. So try to read, don't go in depth of it. So try to read the very basics of any concept and apply it. And if any terms are new, you can then analyze it. So instead of just sitting and reading in a particular topic, spending hours in a particular topic, just read the basics of the topic, move on. Whenever you see a difficult MCQ in a particular topic, which and you're hearing words which are not familiar to you, then you can go and just visualize that concept. So the next topic or the next disorder what we are going to see is stroke. Okay, so what happens basically the brain doesn't receive enough amount of blood, that results in ischemia. Okay, so stroke can be of two types. One is ischemic stroke, another one is hemorrhagic stroke. Okay, ischemic stroke means the brain is not receiving enough amount of oxygen because there is a decreased blood supply, that then the brain cells die. So ischemic stroke is because of insufficient blood supply to a particular area in a brain. Okay, this can be because of a thrombus or embolus. Okay, so thrombus means there is going to be the atherosclerotic plaque formation in the vessel of the brain artery. Okay, any artery or any vessel supplying the brain is affected or as atherosclerotic plaque, that results in incomplete or insufficient blood supply to the particular area of the brain, that results in death of the brain cells. That is the thrombus. Embolus is any rupture of the thrombus, any rupture of the atherosclerotic plaque that travels to the brain from the heart or from the carotid arteries. It travels to the brain and that results in blockage. Okay, so it can be because of a thrombus or embolus. And hemorrhagic stroke, if you see in cases of hypertension or any case of aneurysm. What is aneurysm? Aneurysm is basically dilated blood vessel. So the dilated blood vessel is extremely weak, so it can burst at any point of time. So the blood vessels burst and that results in increased bleeding in that area. That is called as hemorrhagic stroke. Okay, so ischemic stroke and hemorrhagic stroke. So what is the diagnosis you can do? The first thing you should do when a patient comes with a stroke is, you should look about the signs. So ischemic stroke patients, if you see, these patients will have one side hemiparesis, okay, one side hemiparesis. These patients will have slurred speech, and also there's going to be facial droop. On the other hand, if you look at hemorrhagic stroke patients, these patients will have very important, extremely severe headache and vomiting with unconsciousness. Okay, so these patients will have increased or severe extreme headache, vomiting, unconsciousness, whereas the ischemic stroke patients will have hemiparesis, slurred speech, and facial drooping. So once I see the signs, the one very important investigation what I should do is I should take a non-contrast CT brain. Okay, I should take a non-contrast CT brain. So in the non-contrast CT brain, I should distinguish whether there is bleeding or there is no bleeding. Okay, see, if I don't take a CT scan and I just prescribe anticoagulants, imagine if it is because of bleeding, then the patient will die. So I should assess whether the stroke is because of increased bleeding or because of narrowing of the vessel walls. So if it is because of bleeding, then what I will do is I'll try to lower the blood pressure, okay, and then I'll stop anticoagulants. So if it is because of the narrowing or because of the ischemic stroke, then I'll try to give anticoagulants. Okay, so this is how we manage stroke patients. So there are two types: ischemic, hemorrhagic. We talked about what are the causes and what are the signs and symptoms you see, and what is the investigation and treatment. Okay, so with this, the most commonly asked cardiovascular disorders have been covered. So we talked about ischemic heart diseases, angina, and myocardial infarction. We talked about cardiac failure, right, left ventricular cardiac failure. We talked about hypertension. We talked about stroke. So with this, the cardiovascular disorders comes to end. Most commonly asked MCQs are from these topics. So in the evening session, we'll discuss about the MCQs pertaining to these topics. So thank you so much for watching the video. Have a nice day.